While rumors about Bradley Cooper's appearance have circulated for years, a recent Smartless episode marked the first time that he actually addressed these plastic surgery claims. Cooper laughed along and said that strangers have actually been approaching him telling him that, hey, you look good, Brad. But he didn't exactly address the plastic surgery speculation. So let's take a look and see what we think. I'll also reveal how much Bradley may have spent on some of these speculated procedures. So watch till the end to find out. In the year 2000, at the age of 25, Brad has a prominent widow's peak, which is that central tuft of hair right at the central hairline. He also has slight frontotemporal recession. Bradley has low-set brows, and they appear quite flat, which is a common configuration in men. He also has proportional horizontal thirds, so if you look at the general measurements from hairline down to glabella and from glabella to base of nose and base of nose to the bottom of his chin, those proportions are fairly equal. He has slight upper lid hooding of his upper eyelids, more on the right than the left. Brad has a thin upper lip, and he has some upper tooth show on repose when he just parts his lips. He also has a strong chin. In 2001, at the age of 26, you can see that Brad has frontotemporal recession here that's affecting not just this corner here by the hairline, but also a portion of the temple itself. When I look at his nose, I notice that there's a narrow dorsum, there's nasal tip bulbosity, and he has slight dorsal convexity, which is just a small little rounding to the top of his nose. And when he smiles, you can see obvious crow's feet developing at the sides of his eyes. In 2002, at the age of 27, I wanted to point out here that Bradley naturally has medial cheek fullness, more towards the center of the face rather than laterally based fullness. He also has some infraorbital hollowing, which is this area right down here at the lower eyelid as it transitions over to the cheek. In 2003, at the age of 28, I would like to highlight here that Bradley has an acute cervicomental angle, which is this portion of his neck. That's why his neck looks so well sculpted and defined, because his hyoid is set superior and posterior, and he doesn't have really any tissue hanging here because of that acute angle. In 2004, at the age of 29, you can really see here that when Bradley smiles, he has lateral upper eyelid hooding. He has it at rest, but it's amplified with the smile. In 2005, at the age of 30, I see no change. And in 2006, at the age of 31, I also see no change. In 2007, at the age of 32, you can see that Bradley wears his hair combed forward. And that's a very common type of hairstyle when people have some frontotemporal recession. That's a way to hide that recession. So perhaps it was progressing around this time, and he felt the need to cover a portion of that area up. And in 2008, at the age of 33, with his hair pushed up and back, you can see that there's an M-shaped hairline configuration developing here. Keep a close eye on this area as it appears to change later on. In 2009, at the age of 34, I see no change. And in 2010, at the age of 35, I see what looks to be a potential hair transplant. Let me explain. The hairline has a very different shape compared to years prior, and the height of his hairline looks different to me compared to 2008. If it were true, it seems like the design that they selected for the hairline has more of a convex type of shape, which is my preferred shape. Here's an example of one of my recent patients. Contrast that with a more concave type of hairline that accentuates that M shape, and sometimes in a more exaggerated manner can look like Mickey Mouse. And it looks to me that as part of the hairline work, they may have augmented his right temple because the right side was more receded than the left, and it was very naturally done because it's very difficult to tell that any type of surgery was performed. There's excellent irregularity at the hairline, and there's wonderful use of single hair grafts as well for very nice naturality. And they've done an excellent job of blending the transplanted hair with the pre-existing hair in that region, which also takes an artistic eye and strong technical skill. I wanted to take a moment and highlight the importance of finasteride or dutasteride for preventing further loss, especially in a man who's had a hair transplant at the hairline, because any additional progression of hair loss will potentially look less natural, and you'll have to keep chasing it with more and more surgery, and you might down the road run out of grafts. So it's critical to have some foresight here and to play the long game and to prevent any further hair loss from occurring. That's done with the use of DHT blocking medications like finasteride. And a common place where people get their finasteride these days is feelconfident.com. So if you're interested, go and check that out. And remember that natural hair transplant work should be undetectable. That's actually the goal. So when you walk around and see people with a very obvious transplant, that's probably not where Bradley went. In 2011, at the age of 36, what I'm seeing here is the potential introduction of Botox to the glabella and the forehead. It looks like there's less activity in the forehead and in the area between the eyebrows, because at 36, you'd usually see more wrinkles. And in 2012, at the age of 37, I see no change, and that's the same through 2021. In 2022, at the age of 47, I'm seeing here the potential introduction of lateral cheek filler. Remember what I said earlier, with Bradley's natural anatomy, he did have some medial cheek volume that enhanced as he smiled, but you didn't see it extending all the way lateral along the zygomatic arch. That to me spells the potential introduction of some high G' hyaluronic acid filler that may have been used to give him some more volume in that region. There's definitely some deflation that occurs with time as we age, so perhaps he was looking to counter some of those effects with the use of filler. In 2023, at the age of 48, I see no change. In 2024, at the age of 49, I think his hairline still looks great. And the fact that he's retained his crow's feet and does not have those paralyzed with neurotoxin, I think actually brings out a lot more naturality to his face. Had he paralyzed the orbicularis oculi muscle laterally, that would have changed his appearance even more. And in 2025, at the age of 50, this is around the time when people really started to chatter about like what happened to Bradley's face, what did he do? Did he have a facelift? What changed? So I took a close look, and from what I can tell, the main thing that I see when I look at his face is that his eyes now look more open. To my eyes, I think his brows are still in the same low, flat position, but there's now more upper tarsal show. So more upper tarsal show with more open eyes to me suggests a possible upper blepharoplasty. Essentially, removing some excess tissue of the upper eyelid can create this type of appearance change. And when I looked closely at the area around his ears, at all those telltale signs of facelift work, I don't see any signs of an obvious facelift. His neck is still well contoured. It has always been that way for him. And with a male facelift, you'd expect that some of the hair from the beard area would be moved more lateral, closer to the tragus. And also in many videos I talk about the changes to the tragus itself and how it flattens like a pancake and gets thicker typically with facelift work, and he doesn't have any of those obvious signs. So I actually think that Bradley did not have any kind of facelift work. I think the trend has been towards celebrities being a little bit more open about some of the surgeries they may have received, and also some of the non-surgical enhancements that they've done. I think it's a little bit more common nowadays with women when it comes to most facial procedures. They're more willing to talk about it. For guys, it seems like they're maybe a little bit more comfortable discussing some hair changes with the boom of hair transplants around the world. But I still think there is some taboo surrounding men getting some other facial procedures done. And I think over time that will soon fade as well. And guys will be more open about mentioning, some procedures they had without feeling like they, need to carry any shame with them about that. So we'll see what happens with the trends over time, but that's just my guess with what I'm observing and what I notice even with my practice. A lot of people finding us through the internet, basically paying it forward by saying, hey, I'm going to talk about what I had because I've seen your work and I'm feeling great after, the work you've done for me, and I want others to know about it. So I think especially as more celebrities open up, it'll pave the way towards just a more honest and open future for everyone. And in 2026, at the age of 51, I wanted to put up this comparison between Bradley at age 51 and Bradley at age 29. Let's look at some of these differences. Starting from the top and working our way down, we see that Bradley's hairline looks much more robust now. Despite some potential neurotoxin that he may have been receiving, the glabellar rhytids, or the wrinkles there between the eyebrows, are still a bit deeper set compared to him in his 20s. He is aging after all. There's also more supratarsal show, as we talked about previously, and his cheek volume appears to be enhanced. Also, his skin now appears to be more rejuvenated than Bradley in his 20s, so he may have some advanced skincare routine, he may be doing some laser resurfacing to basically upkeep that excellent skin of his. So overall, I think Bradley is aging incredibly well, with maybe some small tweaks along the way. And the total cost of these potential procedures is $110,000. What do you think about Bradley Cooper's transformation? Is it all natural, or did he have some non-surgical and surgical help along the way? Let me know what you think in the comments below, and please make sure to subscribe to this channel for more videos just like this.